Hi, this is James from Cerritos Dental Implant Center. Today's video we're going to cover what is a sinus lift and why you would need a sinus lift in order to place dental implants. So a sinus lift is essentially any part of your upper arch where your sinuses are located. Sometimes the patient does not have enough bone to support a dental implant. Therefore, in these cases, it's good to basically lift up the sinus, place bone behind there in order to secure the implant. So let's go ahead and take a look at this video. This animation basically illustrates this point. So we see from the video right here, the patient, the posterior teeth, the back teeth, needs to be extracted. So after he extracts their teeth, bone level generally goes down. So the white portion, the yellow portion you see right there, that is the level of bone. So because the bone level for the patient in these cases is not enough, in cases like this, we need to lift up or elevate the sinus, put bone grafting material behind there, and then stabilize and place the implants. So also keep in mind too, bone in your upper jaw, it's not very dense bone. It's not as dense as cortical bone or the bone in your lower jaw. So therefore, anytime you place implants on the upper jaw, that's one of the considerations to think of. So if we take a look at the animation right now, the white material that they're placing in there, that is bone grafting material. So they lift up the sinus, they place up the bone graft material, and now they're drilling for the implant. Okay, implant has gone down, now it's secured. So now there's adequate bone in the sinus cavity to basically support the implant. So a common question that people ask is that safe? Is that safe to have basically to elevate the sinus and basically put bone grafting material there? Yes, it is. Basically the sinus cavity, there's a membrane layer on top of it. If you don't break it or perforate it, it'll remain intact. It's very easy to regrow bone or regenerate bone inside the sinus cavity. And basically the bone, any bone that's regenerated will just basically stay there until something happens. So if we take a look at this slide right here, if you take a look at the upper left corner, the patient had 3 implants placed. So a sinus lift was performed in these cases. A lot of bone was packed in there, sinus was elevated. So here's another x-ray. If we take a look at it, adequate bone, the entire implant body is encased and covered in bone. So this is a very good implant stability, and this is what you want. Think of bone as a foundation for your implant. So the more bone that you have, the more stable the implant is going to be. The less bone you have, the more unstable the implant will be in the future. Okay? So now let's go over the cases where people don't bone graft, they don't elevate the sinus. Let's take a look at to see what can possibly happen. So let's take a look at this patient. For this first x-ray here, I want you to focus on the yellow circle right there. So if you take a look here, this is also an area that's dealing with the sinus. The patient has very thin bone. There's not enough bone to really support and hold on to the implant. So if you take a look at this picture, something doesn't look quite right? Okay, well, next slide is going to show you a little bit what's going on. So let's take a look at the red circle. Oh my goodness, what is going on here? Take a look at that red circle. There's an implant somewhere. Where do you think that implant is? Well, the implant in this case is inside of the sinus cavity. The patient did not have a sinus lift, did not have adequate bone graft placed, so there was not enough implant stability when the implant was placed. So what happens in cases like this, the implant will actually fall into the sinus cavity and it's just gone. So the patient, when he opens their mouth, you're unable to find the implant. So this patient was actually referred to us when he first came to us. Before we took the x-ray, we didn't know where the implant was either. It's only after taking the x-ray you're finding out, whoa, my goodness, the implant completely went into the sinus cavity. So at our office, we actually get a number of these cases because a lot of dentists performing implants out there, they don't know what they're doing. A lot of people, they want to save money, they don't want to bone graft. Well, in cases like that, unfortunately, this is what you get. You want your implants to last a long time, and you want your implants to be done well. So do it right the first time, and you can avoid yourself the complications and the headache of having to go through something like this. So in this case, what do? Well, basically, you open up the cavity, in this case, figure out where the implant was, and then they remove the implant. So cases like this, go back to do a sinus lift, bone graft what you need to do before you continue further. Next case, very similar thing. Patient did not bone graft. Look at where that implant is now. It looks like it's on top of its natural teeth, but that's actually not the case. Same thing, implant was not stabilized, did not have achieved primary stability. Implant just fell in through the sinus cavity. So unfortunately, that's going to be another surgery just to retract these implants. Same thing as the first case. This case was also referred to us because the doctor who referred them, they didn't quite understand bone grafting, they didn't quite understand sinus lifts, so unfortunately the patient got stuck with something like this. That concludes today's video. If you have any questions, feel free to email us at help@cerritosimplant.com. Until next time.